Magala General Hospital, the second largest hospital in Tigray, was used to deliver its services not only to the people of Tigray but also to the people of neighboring regions of Afar and Amhara. However, the 2-year-long war, the consequent all-encompassing siege and termination of basic services has compromised the quality of its services. Sister Hiot Aragawi, a coordinator of the RT case team at Magala Hospital, says the peace agreement signed made her happy and hopeful, though it has not yet brought any tangible difference to the people of Tigray, except only for hope.
To ናይ ሰላም ሃዋህው ክንሰምዕ ከለና ሕዚ ፍሉይ ተስፋይነት ተሰሚዕና
We were hopeful after hearing of the peace agreement, and we thought our people would be getting a relief from its multiple problems as soon as possible. However, it has been almost 13 days now since the peace agreement has been signed. Yet still we haven't seen anything tangible besides hope.
Dr. Philemon Mesfin, the chief executive director of the hospital, also says that the hospital is still losing many of its patients due to lack of medical supplies.
Well, the peace agreement has been, since it's been signed, it's been almost 2 or 3 weeks. And they have promised to open the humanitarian corridor before about a week or 2 weeks. But for me, peace agreement, as a hospital CEO, peace agreement have to be as simple as getting medication for my patients. I cannot analyze the other political scenarios or something. For me, it should be as simple as getting the medications and getting the necessary equipment to treat my patients. So for me, that hasn't happened up until now. And I'm expecting, I don't want to be pessimist about this, because it's only been about a week or 2 weeks, and I do feel like the peace agreement can go a bit further, more than what's happening right now. And I do expect that I do have the rumors that the humanitarian corridor may open within shortly. But for me, up until now, the scenario is almost similar, if not worse, because we are losing so many kids every single day. We are losing so many patients just because of shortage of medications. Our staff have been working for the past 18 or 19 months without salary, and they are still here to treat their patients. But without medications and equipment, it's a bit tough job to do. So for me, the peace agreement should be as simple as getting my medications. But up until now, there hasn't been any change on that, and we are losing so many people every single day that we could have saved if we had the medication.
According to Sister Hiot, the hospital has not yet been able to know the whereabouts of half of its HIV positive patients due to the termination of basic service and other related problems.
የማል ሆስፒታል ምስውንስቱ ቀዳማይ ጀማሩ መሆኑ ማለት እዩ ከሁሉ
Magala Hospital is a pioneer hospital in treating HIV-positive patients in Tigray, and we used to treat patients who used to come from different places, including Afar and Amhara regions. Totally, we had around 4,000 permanent and 1,000 emergency patients here. Currently, we don't even know the whereabouts of half of our patients, as we don't have any access to telecommunication. In addition to this, we still don't know what is going on with our patients who live in the areas that are still controlled by Eritrean forces.
Dr. Philemon forwarded his message to the Ethiopian government and all other concerned bodies to fully cooperate and work for the success and common good of the agreement with good faith in order to save the people of Tigray dying from lack of food and medical supplies.
My message would have to be to the government of Ethiopia, because they are already the decision makers on this aspect. So I want to express my concern, and I want to call upon them to act upon what they have signed, to practice what they have signed on the ground. So I know the implementation may not be as easy as signing the papers, but they would have to strive and work a bit harder than they are doing right now to save our people. If the signed paper is hurtfully signed, I believe that both parties want peace, and they have signed this agreement hurtfully, genuinely. So they should act upon what they have signed. And to the other organizations which are concerned on supporting the suffering people of Tigray, I want to call upon them also. Of course, it's not on their hands to bring whatever they want. I know we do have so many contacts with ICRC, WHO. They want to help a lot, but They are not being helped from the central government. They are not being allowed to bring in whatever they have in their stores and warehouses to Tigray. So I want them to push a little further to pressure the central government.